want to talk now about police reform in Ohio. There have been some things that we have been able to do by executive action. On June 17th of last year, I ordered every cabinet agency to review the use of force policies and also to ban the use of chokeholds. That has been done. So every department under my direct jurisdiction, Highway Patrol, Ohio Department of Natural Resources, and others have now banned the use of chokeholds. Last summer, I ordered the Highway Patrol to start the action to obtain body cameras for everyone. For some time, they have had dash cameras, but I felt it was appropriate now for them to lead by example and to have the body cameras. The purchasing of these body cameras has begun, and we would anticipate within a short period of time, the members of the Highway Patrol will always have on the body cameras. Next, we established the Office of Law Enforcement Recruiting within the Office of Criminal Justice Services, again, to help local law enforcement in this area. Next, I ordered the Ohio Community Police Collaborative to develop a standard for law enforcement responses to mass protests. And I'm happy to say that they have now adopted a uniform standard. Let me talk for a moment about several budget initiatives that are now in front of the General Assembly. Several things that are pertinent were contained in our budget. We had $10 million we provided for law enforcement body cameras for local law enforcement around the state of Ohio. In addition to that, we provide in our budget $1 million in grant funding to support local police agencies and innovative initiatives to recruit women and minorities. These are two things that are contained in our budget. Let me now turn to legislative proposals. I talked this morning with State Representative Phil Plummer. Phil is a former sheriff of Montgomery County. He's been working on a law enforcement reform package. We have worked with him on this. I'm happy to say that he advises me that this bill will now be ready to be introduced within the next few days. This bill will increase accountability and transparency in law enforcement. It was developed with the help of the Ohio Attorney General's Office, of veteran law enforcement officers, organizations including the Ohio Association of Chiefs of Police and the Buckeye State Sheriff's Association, as well as civil rights leaders. This bill will do a number of things. Let me just mention several. We'll establish a peace officer oversight board. It is time that in Ohio we begin to treat law enforcement as the professionals that they are. What does that mean? It means that in other professions, if you're a doctor, you're a nurse, you're a lawyer, we could go on and on. There's not only state regulations, there's a state board, there's a state disciplinary board, a state board that has the ability to pull a license, to suspend a license. It's time we do that in the area of law enforcement. Again, it is a profession. We should treat it as such. Next, the bill also establishes a use of force database, a statewide use of force database, so that the almost 1,000 law enforcement agencies in the state of Ohio would report use of force, and that would be contained in one central location whenever the use of force was used. Next, it would establish an officer discipline database, an officer discipline database. And again, this goes back to treating law enforcement as the profession that it is. So situation we have now is someone can go from one police department to another, and if they left under bad terms and that officer doesn't even report that he worked at the other law enforcement agency, and it's clear across the state, one law enforcement agency may have no idea that he had been worked for another law enforcement agency. Again, an officer discipline database. Fourth, will require an independent investigation of officer-involved critical incidents. Again, outside, impartial, coming in, I think will give people more confidence in the end results. I think there's also a general agreement that we need more police training. I've never met a police officer who did not think that more training was good. We need an independent, sustainable funding source for law enforcement training in Ohio. Last month, as part of the need to address law enforcement training in the state, I asked the Justice of Criminal Justice Services to send out a survey to law enforcement agencies all throughout the state of Ohio. And we asked them to identify training needs and the type of training that they actually have conducted in the last year. Aspirationally what they want, but also what have they done. The survey is back on the 30th this month. The information from this survey is going to be used to assist in studying the potential for developing a long-term funding solution for law enforcement training in Ohio. I know, talking with Phil Plummer this morning, I've not looked at the language, but he tells me that there is language and money in the bill that he has introduced in regard to law enforcement training. Once we have established an independent funding source, we need to mandate minimum continuing professional education training hours, just as we do in other professions. Certainly, that should always include de-escalation and use of force training. Fran and I had the opportunity this morning to visit Primary One Health vaccination site at St. Stephen's Community House in Columbus. I just say at St. Stephen's, they do some amazing work helping everyone from young children all the way up to senior citizens, and they've done that for over 100 years. Primary One Health, a community health center, operates a number of clinics around the city, and they go giving vaccinations from one clinic to another. Primary One Health, like other health centers and providers, are receiving state vaccine allocations every week. Let me commend Primary One, their team. I had the opportunity to meet. Fran and I did a number of their members of their team today. And others like them are working hard to ensure their efforts are focused on delivering vaccine to everyone, and certainly including communities of color. Fran and I talked to one man. It's always interesting what you find and what you hear when you talk to people and ask them, why are you getting vaccinated? I always say, did you have a hesitancy about getting vaccinated? And there's always a story about, how they got there and why they are there. And one man told us, he said, I've got an 86-year-old mother, and she's already received her vaccine. I take care of her. I want to make sure she's around for a long time, and I felt I needed to get the vaccine. So everyone's got a story, and so many people are getting the vaccine and getting that yet for others. Clinic at St. Stephen's is just here when you talk to people and ask them, why are you getting vaccinated? I always say, did you have a hesitancy about getting vaccinated? And there's always a story about, how they got there and why they are there. And one man told us, he said, I've got an 86-year-old mother, and she's already received her vaccine, and I take care of her. I want to make sure she's around for a long time, and I felt I needed to get the vaccine. So everyone's got a story, and so many people are getting the vaccine and getting that yet for others. Clinic at St. Stephen's is just a great example, I think, of efforts across Ohio to ensure that all Ohioans have access to this very precious and life-saving vaccine. April is Minority Health Month. Every day our team is focused in our local health department partners and nonprofits throughout the state and so many others are focusing on making sure vaccines are delivered fairly to minority communities, underserved communities. We still have much to do to make sure all Ohioans are reached and it's convenient and easy for every Ohioan to get it. But I just want to again commend the work that Primary One is doing and other health clinics like them across the state. Tomorrow is Earth Day. It's also our grandson Grady's birthday. We plan on, Fran and I just were talking on the phone a minute ago, plan on planting, Grady always plants a tree and, deciding what kind of tree and talk with Grady tonight about what kind of tree we'll plant tomorrow. So plant a tree in honor of Grady in honor of Earth Day. Earth Day is a great opportunity to recognize what each one of us can do to protect the earth, protect our planet. One of the things that we can do is help clean up litter. Litter is ugly and it costs a lot. So I asked the Ohio Department of Natural Resources, the Ohio Department of Transportation, the Ohio Environmental Protection Agency to launch a campaign to focus on how a little bit of litter contributes to the bigger statewide problem. This new campaign will prioritize sharing information about litter, why it's a problem, and what we can each do to stop from adding to this litter problem. Additionally, our agencies will host various events throughout the spring and the summer, including a litter summit. Today, the Ohio Department of Transportation Director Jack Marshbanks is out the ODOT Hilliard Garage with the City of Columbus Director of Public Service Jennifer Gallagher. This week, they challenged their respective staffs to a friendly competition of who can collect the most garbage. So let me go to them now. Director Marshbanks, how are you?
Governor, I am fine. Thank you for your leadership in these trying times. And yes, we are having our Step Up, Pick Up Litter Challenge with the City of Columbus. We have Public Service Director Jennifer Gallagher with us this afternoon. I would also like to introduce our Ohio EPA Director, Lori Stevenson.
Yes.
Lori's here. And our Ohio Department of Natural Resources Director, Mary Mertz, who knows all about trees. She's here also. So I wanted to share with everyone that we are working together cabinet-wide to make sure that we are making Ohio as beautiful as it can be. One of the most annoying and unfortunate things we have to do at ODOT is pick up the trash of other people along our roadways. It might seem like it's just a little bit of litter to you when you toss it out of your car, but it's a big problem. Last year alone, ODOT picked up 362,000 bags of trash with our crews, our Adopt a Highway volunteers and inmates. In Franklin County alone, we picked up over 29,000 bags of trash. And these trucks behind us, that's 100 bags of trash in the ODOT truck. And that's what we pick up in one day. So we are asking people to do their part. Dispose of your trash in the proper place, not on our roadsides. And equally important, make sure if you're carrying a load down our highways that it's tied down. And if you're carrying something even larger, put a tarp over it. Together, we can demonstrate pride of place as Ohioans. And we're working together. And we thank everyone out there listening for helping us and making litter a blight of the past. I'd like to introduce right now, Governor, our City of Columbus Public Service Director, Jennifer Gallagher, will tell you some more about the challenge. Jennifer?
Director Gallagher, thank you very much for joining us. Thank you for what you do.
Good afternoon, Governor DeWine. Thank you for inviting me to be here today on the eve of Earth Day. I think you know that the City of Columbus and the Ohio Department of Transportation are engaged in a friendly competition to see whose crews collect the most litter along our roadways. We are battling it up in a Step Up and Pick Up Litter Challenge during this week of Earth Day to clean up our communities. Mayor Ginther and Director Marchbanks have had clean fun engaging in a little trash talk during this challenge. But there really is nothing funny about the serious problem of litter. This unsightly and unacceptable pollution strewn along our roadsides and elsewhere denigrates our community and causes damaging environmental impacts. Often, litter is a great problem in our neighborhoods that are already challenged in socioeconomic factors. On this day before Earth Day in 2021, Columbus continues to move closer to being an equitable and sustainable city. My Department of Public Service leads our city's aggressive litter abasement efforts. Last year, we completed our first ever litter index to score and catalog the amount of litter on Columbus streets. This will help us prioritize cleanup and enforcement. Our department cleans up illegally dumped trash and debris in city alleys and litter along state highways and city arterial streets. We also work with the Franklin County Municipal Court to use litter collection as an alternative sentence when appropriate. Even though we are opponents in the Step Up and Pick Up Challenge, Columbus does assist ODOT with litter cleanup along freeways and ramps when needed. In the near future, Mayor Ginther and I will be announcing a major initiative that will employ hundreds of Columbus teens and young adults to collect litter and participate in hands-on environmental educational activities, inspiring them to become leaders in protecting our precious environment. Even before our competition with ODOT began on Monday, Columbus street maintenance crews had cleaned up more than 26 tons, yes, 26 tons of litter and almost 200 tires discarded along our city roadways. It is a messy task that also poses safety risks for our crews. It is a task that shouldn't be necessary, as Director Marchbanks mentioned. Litter is a solvable problem when each of us takes the time and personal responsibility to properly dispose of our trash. Use public trash receptacles, or wait until you get home to toss your trash in our refuse container and recyclables in your cart. Get involved in community cleanups. Our city has a very active Keep Columbus Beautiful program. Countless volunteers devote thousands of hours each year to litter collection in neighborhoods throughout our community. Just join the effort. Challenge a neighboring subdivision to see who can collect the most litter to build pride and friendships, similar to the competition this week between us and ODOT. Now, Governor ODOT is a worthy opponent. With all due respect to Director Marchbanks and his team, when the final tally is announced tomorrow on Earth Day of how much litter each of our crews has collected this week, I do think that the city is going to walk away with the bragging rights. Thank you for hosting me here today. I so appreciate it.
Director Gallagher, thank you very much. And to all four directors, we appreciate it, and keep picking up the trash, and we'll see who wins.
ODOT will be victorious, Governor.
Thank you. Appreciate
right,
it. Thanks,
Thanks,
everybody.
Bye.
Eric, let's go to the slides for the data. We'll start first with the daily data. Cases 1789. The good news is we're seeing what appears to be certainly a plateau in cases. We will feel better when it's really a defined downward direction. I don't think we can say we're there yet, but we certainly hope as more and more people get vaccinated, we're crowding this virus out, making it tough for this virus to spread. So it's still at a high rate, but it's certainly not going up, and we're seeing certainly a very significant leveling off. If we look at the other numbers, unfortunately, our hospitalizations are higher than they have been. On the average, ICU is right what the 21-day average. Let's go to the next one, Eric. We look at this is all 88 counties. Again, this is the key indicator. Our top county, unfortunately, remains Lucas County at 357 cases per 100,000 over a 2-week period of time. So Lucas, Williams, Madison, Erie, Summit, Cuyahoga, Jefferson, Defiance, Ashtabula. Those are the top, unfortunately, the top counties. And lowest county is Gallia and Meigs and Fayette. So again, as we look at this, again, we would hope that this would all become white. We're still at a pretty high level, as you can see, about 3.5 times what the CDC says is high incident level. And this is appearing certainly more prominently in the northern part of the state. Eric, we'll go to the next. Again, this is the top counties. We'll go to the next one, Eric. Our daily slide. This is our daily slide of vaccine. First thing I look at comes out usually around midday, and certainly keeping an eye on that. These are first doses, 29,000. So not certainly where we want to be, not where we have been. We had days that were 80 and 90,000, and we've seen certainly a significant decline in the number of first doses. I want to look at the age groups, and I think the age groups are quite interesting because our older Ohioans, those numbers continue to slowly go up, even though they're already at a fairly high rate. Over 80 is 70, almost 74.5%. 75 to 79 is 75.5%. 70 to 74 is 78%. That population has got the vaccine, and 65 to 69 is 72. And we drop off, from there. One of the keys going forward, obviously, is to get people 50 and under taking it at a higher rate than what we're seeing so far. And interesting, if you look at the first doses, I asked our team to break it out for just 16 and 17-year-olds, and not bad. Almost a fifth of all of them, 18.6% of 16 and 17-year-olds have now received their first dose. So that's what happens with our younger people is really going to determine, how fast we can reach this herd immunity, how fast we can reach the numbers that we need to reach to make us a lot safer. Second dose, Eric, you can put that slide up. And again, 66,000 first dose, second doses yesterday. So those numbers are hanging in there pretty good on the second doses. We are now at 38, going back to the first doses, 38% of the population, the total population of the state, and some people obviously are not even eligible. 38% of the total population of the state has got the first dose, and 27.5% are now fully vaccinated. Eric, we'll go to the hospitalization slides. Again, these are lagging indicators. 1243 is the number for today. So as we look at the virus, where are we today in Ohio in regard to our battle? These are really the essential facts. 38% of us, more than 4.4 million of us, have now received our first shot. That's good. Second, cases, while high, seem to have plateaued. That's good. Third, though, it is not good, and that is the virus is more contagious than it's ever been. Some estimates are 40% more contagious. The way Dr. Vanderhoff explains it is it sticks better. So the first two facts are good. Third fact is not good. So Dr. Vanderhoff, let's go to you, and maybe kind of from a medical point of view and a health point of view, maybe talk a little bit about we're kind of settling out into two different groups, and they're certainly not permanent groups. We're having more people vaccinated every day, but we have a significant number of us, almost 40% now, of us who are vaccinated, and we obviously have people who are not vaccinated. Some are not even eligible yet. But talk to us a little bit about the risk of where each group might be, and how we should think about this as we move forward, and how individuals can think about it.
Well, thank you, Governor. As you note, the pandemic is quickly evolving into a tale of two groups of Ohioans. On the one hand, we have the vaccinated Ohioans who are very well protected against this virus and much less likely to spread it to other people. Their situation is very good. But that very good situation for the vaccinated contrasts sharply with that for the unvaccinated. Unvaccinated Ohioans simply lack the same protection against the virus, which is now, as you noted, more contagious, and able to put younger people at much greater risk, including the risk of ending up in the hospital. Also, as you noted, essentially, the new variants have evolved to stick more easily to our cells. So it takes less of the virus, less exposure to make a person sick. You add to that the fact that more older Ohioans, and you reviewed those numbers, have been vaccinated. And it all means that if you're young and unvaccinated, what might not have been much of a concern to you this fall sure ought to be a concern right now. And if you're counting on herd immunity to cover you, you really can't count on it yet. Now, there's no doubt our herd, our population, is more and more protected as a result of vaccines.
Just so you know,